knock.
Hi.
Hi.
I'm the nurse. I'm Stacy.
I'm Veronica.
Nice to meet you,
Nice to
Veronica.
meet you.
How are you doing today?
I'm okay.
Good. Okay. I'm gonna ask you a couple questions. How old are you?
I'm 24.
Okay. Do you smoke?
I do smoke.
How much?
I smoke probably 30 packs a week.
Okay. 30 packs. Do you drink?
Yes.
How much?
I usually go out a couple of times a week. I went out last night.
And how much do you drink?
I drink a lot. I
How
drink
much is a lot?
like 5 shots of vodka, and this guy bought me 2 AMFs, and by the end I was just done.
Sounds like you party hard, huh?
Sometimes.
Sometimes. All right. Tell me about yourself. Are you sexually active?
Yes.
Okay. Monogamous? Or
Yeah.
okay. All right. What about where are you living right now?
I'm living a few miles down Wilshire with my boyfriend.
Uh-huh.
Yeah.
How long have you guys been together?
2 years.
Uh-huh. Do you work?
I don't work. I'm just in school right now.
Uh-huh. And what do you do about money?
I'm on a loan, but I'm also, my boyfriend supports me through a lot of it. He's a big source of money.
Income?
Yeah.
All right. So you rely on him a lot, right?
Yeah.
Alrighty. Okay, well, I'm going to give you a gown. I'm going to step out and I'm going to have you change, okay?
Okay.
Thank you. Hey guys, during today's post-conference, I've got a new case study for you guys. I have a 24-year-old Hispanic female. She has a history of smoking, alcohol abuse, and depression. She was just here for a women's health checkup. Social history, she's sexually active, she lives with her boyfriend, she has no familial support, she's estranged from her parents, and she's financially unstable.
Okay, so considering this patient's medical and social history, what do you guys think would be one of the screening guidelines we would focus on?
How about intimate partner violence?
Good job! Okay, so how would the screening guideline provide benefits for our patient?
So screening instruments for intimate partner violence can identify current and past abuse or increased risk for abuse.
Okay.
I also saw that the USPSTF found adequate evidence that effective interventions can reduce violence, abuse, and physical or mental harm to women of reproductive age.
And I also think it's important to bring up that there are health consequences with many long-term effects like pelvic inflammatory disease, sexually transmitted diseases, unintended pregnancy, as well as chronic health conditions like depression, PTSD, anxiety, substance abuse, and suicidal behavior.
Good. Great job, guys.
Okay, so after looking at several articles, it was found that our population of women of childbearing age do not adhere to the recommendation of screening for intimate partner violence. What do you guys think would be reasons for these findings?
So one thing I think is that they are financially unstable.
Okay.
Let's say lack of resources.
Good one.
And there's also evidence of health disparities such as language and cultural differences and low socioeconomic status.
Good job, guys. Okay, guys, can you describe identified risks and limitations of the screening procedure?
Well, one potential risk is violence backlash from the partner.
Okay.
And some controversies and barriers might be access, not having access to resources, not having access for transportation to and from clinics and screening centers, and maybe the fact that they might not speak English that well, and cultural and religious beliefs of the submissive female role.
Sounds great.
And then just looking at some barriers for healthcare providers, First is just the anesthetics of the question. So how do you come about asking the patient whether they're being abused and what terms you use? Time, having enough time to ask these questions, and then fear of a hostile reaction from that person when bringing up these questions. So those are some barriers.
Good job.
It seems as though the evidence for the prevalence of adherence is low for this guideline. Can you tell me more about this research?
Okay, well, according to the research conducted by the Oregon Evidence-Based Practice Center, reasons why the prevalence might be low can be there's a lack of consensus on which instrument to use when implementing the guideline. There can also be lack of training among the healthcare providers, and there's also a lack of effectiveness of studies about what to do if intimate partner violence is identified.
Another thing that you guys should think about as a nurse is how to address concerns about intimate partner violence with sensitivity and clarity. Intimate partner violence introduces significant safety issues that can compel a provider to be fully informed on such aspects as sensitivity. You should also need easy access to available tools, specific guidelines, and other related materials to help them and you as a nurse develop a clinical environment dedicated to the safety of your patients. Okay, so another question for you guys. What specific theory or model can you apply to explain the types of risk factors influencing adherence to the screening procedure?
Okay, well, I was thinking we can take a look at this from a health belief model perspective. So one of the components is perceived susceptibility. In this case, the patient may be unaware that they're experiencing intimate partner violence. A lot of this comes from the fact that they believe that intimate partner violence is just physical abuse, but it can also be emotional abuse.
Okay, so I know that the next thing is perceived severity. So they may not think that the abuse is severe enough to seek help, or they may prefer to stay in an abusive relationship rather than leave due to threats, economic issues, or lack of support.
Perceived benefit is also that the patient can use the tool as an outlet to localize their situation and get help when otherwise it might not be available.
And a perceived barrier that they might be faced with is whether or not they have time, money, or the willingness to seek help.
You guys describe effective strategies that a CNL can use to influence the healthcare system and healthcare providers to increase delivery of screening recommendations.
Well, I know that there's studies out there that show the effectiveness of implementing a hospital-wide protocol on screening.
Mm-hmm. And in one of these studies, the effect of having a staff member, like a physician's assistant, designated as an intimate partner violence victim advocate in an emergency department, for example, was evaluated, and that led to an increased detection of intimate partner violence.
And then I know that one thing that is important is additional training on IPV. So that includes information on medical or psychosocial indicators of IPV, as well as sensitivity and communication training of how to ask.
Now let's describe current social, environmental, and health policy implications of the current screening recommendations and how these can enhance population-based screenings.
Well, there are currently legislations and policies such as the Partnership to End Domestic Violence, which increase safety for victims of domestic violence and their children as well. For example, domestic violence resources and national hotlines are currently available that address social implications of intimate partner violence.
As far as the role of the healthcare system, so there is a policy being implemented that is referred to as the RADAR protocol. So RADAR consists of routinely screening for IPV, asking direct questions, documenting your findings, assessing safety, and responding, reviewing options, and then referring the patient.
Good, okay, so based on these legislations and protocols, we can enhance screening for intimate partner violence. Referring our patients to these resources can educate and increase awareness, And knowing that legislations and policies are in place can allow healthcare professionals such as us to implement the use of these tools to screen for intimate partner.
Hi Veronica, I'm Naz, I'm a nursing student.
Hi.
Hi there. So I wanted to go ahead and talk to you today regarding some of the questions that we asked you about earlier. And based on the information that we got, I'd like to ask you some further questions. Would that be okay with you?
Sure.
Great.